Welcome back to the Breathing Room podcast, where we discuss medications, respiratory health, and ways to improve quality of life. Today's episode is about Trelegy Ellipta, a medication commonly prescribed for COPD and asthma. Joining me is respiratory specialist Taylor. Thanks for being here.
Thanks for having me. Trelegy is one of the most commonly prescribed maintenance inhalers today, so it's a great medication to discuss.
That sounds wonderful. Let's start with the basics. What exactly is Trelegy Ellipta?
Trelegy Ellipta is a prescription inhaler that contains 3 medications in one device. The 3 drugs are fluticasone furoate, imeclidinium, and vilanterol. What's unique about Trelegy, it combines 3 different medication classes. Fluticasone is an inhaled corticosteroid, also known as an ICS. Imeclidinium is a long-acting muscarinic antagonist, also called a LMAA. Vilanterol is a long-acting beta-2 agonist known as an LABA.
So patients get all 3 medications from one inhaler.
Exactly, which helps simplify treatment and improve compliance.
That makes a lot of sense. Who is Trelegy typically prescribed for?
Trelegy has 3 major indications. First, it's used for maintenance treatments for chronic obstructive pulmonary disease or COPD. And second, it helps reduce COPD exacerbation or flare-ups. And third, it's approved as maintenance therapy for asthma in adults whose symptoms aren't adequately controlled.
What makes it different from other inhalers on the market?
There are several advantages. It's a once daily dosing. There are 3 medications combined into one inhaler, improves lung function, and reduces exacerbations, and helps improve quality of life and daily activity tolerance.
I can definitely see the advantages. Can you explain how Trelegy works?
Absolutely. Think of Trelegy as a 3-person fighting and breathing problems. First, fluticasone reduces inflammation in the airways, and inflamed airways become swollen and produce excess mucus. By decreasing inflammation, breathing becomes easier. Second, imeclidinium blocks muscarinic receptors. When those receptors are blocked, airway muscles relax and stay open. Third, vilanterol stimulates beta-2 receptors in the lungs, and this causes bronchodilation, meaning the airways widen and the airflow improves.
So one medication reduces swelling while the other 2 help keep the airways open?
Exactly, that's why it's called a triple therapy.
That definitely makes a lot of sense. How is Trelegy administered?
Trelegy is usually given through an oral inhalation using an Ellipta inhaler device once daily. Patients should use it at the same time every day.
Can patients take extra doses if they're having trouble breathing?
No, so Trelegy is a maintenance medication and not a rescue medication. So for sudden breathing problems, patients should use a rescue inhaler such as albuterol and seek medical attention if symptoms worsen.
Let's pretend that you and I are both nurses. What should we monitor with our patients?
There's several things that we should monitor, but most importantly is the respiratory rate, their oxygen saturation, lung sounds, frequency of asthma or COPD, flare-ups, proper inhaler techniques, heart rate, blood pressure, and signs of oral thrush. Nurses should also verify that the patient understands Trelegy is not intended for acute asthma attacks.
Yeah, that is definitely a huge teaching point.
Absolutely.
Let's go ahead and talk about side effects next. Can you tell me about some common side effects?
Common side effects are like headache, sore throat, hoarseness, cough, upper respiratory infections, oral thrush, sinus infections, and back pain.
Okay, those are generally manageable, but should definitely be reported if persistent, correct?
Exactly.
So are there any serious reactions patients should know about?
Some rare but serious adverse reactions include anaphylaxis, severe allergy reactions, pneumonia, paradoxical bronchospasm, glaucoma worsening, increased eye pressure, urinary retention, cardiac arrhythmias, and severe tachycardia.
And if those occur?
Tell them to seek medical attention immediately.
Gotcha. Moving on to the healthcare provider's role, what interactions should they be watching for?
Major drug interactions include beta blockers, other LABA medications, strong CYP3A4 inhibitors, and anticholinergic medications. So using similar medications together can increase side effects or decrease effectiveness.
That makes a lot of sense. How about any food interactions?
There aren't any really significant food interactions, but patients should maintain healthy habits that support lung function and overall wellness.
That's a great point. What should every patient know before leaving the clinic with their new prescription?
What they should know is that they have to use Trelegy every day. Do not use it as a rescue inhaler. You want to rinse your mouth out after each dose and learn proper inhaler technique. report worsening breathing symptoms, keep follow-up appointments, and store inhaler properly at room temperature.
I feel like rinsing the mouth is one of the most important reminders for patients.
Definitely, it greatly reduces the risk of oral thrush.
Let's talk money because patients always ask.
Without insurance, Trelegy can cost approximately like $600 to $800 per month. However, many insurance plans cover it, and manufacturing saving programs may significantly reduce out-of-pocket costs.
Always worth checking with the pharmacy and insurance companies for sure.
Absolutely, yeah.
Okay, so let's go ahead and kind of recap what we've talked about. Trelegy Ellipta combines fluticasone, imeclidinium, and Vilantrol into one inhaler. It's used for COPD and asthma maintenance therapy, improves lung function, reduces flare-ups, and is taken once daily.
Patients should use it consistently. Rinse your mouth out after each use, understand potential side effects, and remember that it's not a rescue inhaler.
That is important, yes. Before we end today's episode, we'd like to acknowledge the scholarly sources used for this discussion. First, Davis Drug Guide for Nurses. Additionally, the National Library of Medicine and Frontiers in Allergy for their article, Real Life Effectiveness of Triple Action Therapy. Thanks for listening to the Breathing Room podcast. Until next time, keep breathing easy.